Dr. Saunders here again from naturaleDoctor.com, and we're going to discuss how people get on so many drugs and why they would want to get off them in the first place. There are, when someone has a condition that requires a medication, very often that medication will have a problem like a side effect associated with it. Then often they're put on another medication to counteract that side effect, which will have another side effect, and then they have to counteract that side effect. And you may laugh, but it's not funny because many people are on multiple medications for only one condition. Let me give you an example. One of my patients who came into a nursing home had arthritis. Because of the arthritis, she was put on a non-steroidal anti-inflammatory, a drug to relieve the inflammation from arthritis. Well, that drug has, one of the side effects is it causes ulcers in the stomach. So she was put on another drug to stop ulcers in the stomach. And then that drug causes osteoporosis. She was put on another drug for osteoporosis. She also got neuropathy because she wasn't getting enough B12, so she was putting on another drug for neuropathy. One condition, 5 drugs. And that's how it can snowball. So even though the conditions that people have are the same, what we're seeing today is more and more drugs that people are taking. So they're on a multitude of drugs instead of just one. If you're in your 60s or 70s and you go to a doctor's office and he asks, what drugs are you taking? And you say none, he's going to go, what? You're not taking any drugs? It would be kind of a surprise. I actually had patients who'd gone to the hospital and in the emergency department, they didn't believe them that they weren't taking any drugs at all. So what happens with all of those medications is they interact with each other. I recently had a patient who had to go on dialysis because of medications that she was taking for diabetes. This can be avoided. It doesn't have to happen. When natural methods are used, people don't get the side effects. They continue on naturally. Let me give you an example. There was a study done in England on diabetes. Half of the people out of these 3,000 people, half the people are on diet control, the other half are on drugs. And the people on drugs, they have lower blood sugar, lower cholesterol, lower blood pressure, all their numbers look great. And the people on the diet control, all their numbers are higher, that they don't look, it doesn't look like they're healthier. However, over the period of time of the study, what they found was the people on diet control had 12% less dialysis, 12% less blindness and amputations and heart disease than the people who were on the medications, because the medications themselves cause problems. So the natural way is a better way to do it. Here at Natural eDoctor, we want to help you to learn how to be healthy without drugs.